Hello, I'm Dr. Kim Youngkyun from K Dental Clinic for Oral and Maxillofacial Surgery. Welcome to Journal Inside. As many of you know, achieving primary stability is very crucial for the success of implant treatment. To ensure reliable osseointegration, it's been widely accepted that applying load typically begins around 3 to 6 months after implant placement. That's right. This approach remains valid, and the longer we wait, the more stable the implant tends to become. With recent advancements in surface treatment technology, modern implant systems have significantly shortened healing periods. It has now become possible to apply prosthetic loading 4 to 6 weeks after implant placement both in the mandible and maxilla. In 2016, I published a prospective randomized clinical trial of hydrophilic tapered implant placement in the maxillary posterior region, evaluating loading at 6 to 12 weeks after implant surgery. The article we're covering today is exactly that study. Let's take a look at the research methodology. In this study, implants were placed using a one-stage surgical protocol in the maxillary posterior region with poor bone quality. The cases were then compared based on whether the prosthetic restoration was placed at 6 weeks or at 12 weeks after implant placement. The implants used in the study were OSSTEM's TS3CA implants. These implants are hydrophilic tapered implants with CAP coating. Only implants with a diameter of 4.5 mm and 5 mm, and the length of 10 mm were selected for the study. All implants were placed using one-stage surgical protocol and insertion torque and Osstlementor values were measured. During the observation period, the amount of marginal bone loss around implants as well as implant success rate were evaluated. To ensure consistent radiographic imaging throughout the study, a customized positioning frame was fabricated using a positioner and putty, and periapical radiographs were taken. As a prospective randomized clinical trial, the study maintained strict inclusion and exclusion criteria for case selection. A total of 68 patients initially participated in this study, but after applying the exclusion criteria, 52 patients were finally selected for the study. Cases were excluded from the study if the ISQ value at the time of implant placement was below 65. Osseointegration failed during healing, hypersensitivity occurred during impression taking, or patients failed to attend follow-up visits. During the study period, the 22 patients were excluded due to the reasons such as withdrawal of consent, loss to follow-up, failure of osseointegration, poor primary stability, hypersensitive responses during impression taking. Group 1 received prosthetic loading 12 weeks after implant placement, while Group 2 received prosthetic loading 6 weeks after implant placement. Let's take a look at the results. The ISQ values measured 3 times during implant placement showed no statistically significant difference between the two groups. ISQ1, primary stability measured at the time of implant placement, demonstrated a great correlation with bone quality. Poor bone quality such as D3 and D4 resulted in lower primary stability compared to D2 bones. However, the secondary stability such as ISQ2 and ISQ3 did not show a strong correlation with bone quality. This suggests successful osseointegration of implants over time. The ISQ values were not related to the diameter of the implant or the final drill. In both groups 1 and 2, there was no statistically significant difference between ISQ values of implants placed in premolar and molar regions. All 41 implants showed 100% survival rate during the 20.6-month observation period. However, one implant placed in the left maxillary first molar showed 2.4 mm of marginal bone loss after 1 year, resulting in a success rate of 97.56%. In conclusion, under both the 6-week and 12-week loading protocols, OSSTEM's TS3CA implants demonstrated favorable outcomes in the study. This study confirmed that an increase in ISQ values over time in implants placed in maxillary posterior region with poor bone quality indicates successful early osseointegration. The conclusion is straightforward. When placing TS3CA implants in the maxillary posterior region, if good primary stability is achieved, prosthesis loading after 6 weeks can be considered a safe approach. As the author of this study, I would like to emphasize an important point. In cases of insufficient primary stability after implant placement, it is important to consider extending the healing period. It is evident that advancements in implant quality have remarkably shortened the period required for osseointegration. When excellent primary stability is achieved, early or immediate loading can be a viable option. However, if the patient is willing to accept a longer treatment period, extending the healing time is clearly a much safer option. This concludes today's article. I will be back with another valuable paper next time. Thank you.
감사합니다.